Hi, Jane. We are just giving folks a few more minutes to join, and then we'll officially get started in about 2 minutes.
Can you hear me?
Yes.
Okay. Oh, yeah, right there. Okay. Be right back.
Okay.
Right after, in the late afternoon.
Hi, Julia. Good to see you joining us this afternoon. We're just going to go ahead and get started in about 30 seconds. Hi, Robert. Nice to see you this afternoon. Thank you for joining us. And just leaving about 30 more seconds for a few more folks to join, and then we will go ahead and start our candidate forum. Hello, everyone. My name is Tony Panetta, and I'm the Chief Impact Officer for the Alameda Health Consortium. I'll be your moderator today for today's District 7 Candidate Forum. I'm very excited that the top candidates for California Senate District 7, Jesse Arreguin and Jovanka Beckles, are both here for this important discussion with our health center leadership and staff and other members of our community. I'd like to briefly walk you through today's agenda. We're going to start with introductions and housekeeping, followed by moderated questions where each of our health center leaders will ask questions for each of the candidates to have an opportunity to respond. Then we will open the call to audience Q&A. Then we will provide time for closing statements from each of our candidates, and then we will close out the session. Before we do get started, I do want to provide a little bit of background about the Alameda Health Consortium and who we are. We are the regional association of 8 federally qualified health centers that have collectively over 100 clinic locations and mobile units that collectively serve more than 285,000 patients in the East Bay. Collectively, we advocate for high quality healthcare for the medically underserved in the East Bay. We share best practices to sustain, expand, and diversify our community's safety net healthcare workforce. And we collaborate as thought partners with policymakers to inform, shape, and implement health policy changes. With our member community health centers, we also organize civic engagement and leadership opportunities to provide education and skills for health center staff and their patients and advocate community to engage more closely in advocacy efforts and in turn engage their patients to exercise their voice in increasing access to care. Overall, our health centers were born out of the civil rights and social justice movements out of the 1960s. We have a very proud history of advocating for access to high quality healthcare services for all. And our history includes access through community health centers, migrant health centers that were established as a response to address the growing healthcare disparities of our historically marginalized communities. We've resulted from a core belief that access to affordable, accessible, high-quality healthcare should be provided with respect and dignity to all who walk through our doors, regardless of insurance status, income, and immigration status. These are how our health centers are oriented by mission and by mandate, and collectively, our 8 health centers serve as the backbone of the safety net primary care delivery system for the County of Alameda. In fact, our health centers are responsible for serving up upwards of 40% of Alameda Alliance for Health's Medi-Cal patient population. And we are proud of the ability to provide services to anyone who walks through our doors at any point in their life journey. So with that, we're going to turn into the more moderated forum portion of our conversation today. And as I said previously, I'm thrilled to be here this afternoon. I'm thrilled that we have our CEOs joining us for this conversation and the 2 top candidates for Senate District 7. This really is an important opportunity for our community to get to know the top candidates, as well as to ask questions about the candidates' priorities and their respective vision for the district and how they hope to implement positive changes for our community. Our health center leadership will be asking questions today. These are leaders from health centers that have locations that are located in the district. I will be calling on each health center leader to ask questions that reflect the pressing issues in Alameda County and our communities are facing. Each candidate will have time to introduce themselves and then answer the questions. But first, I do want to share a few ground rules before we begin. First, this is a nonpartisan forum to provide education to our community. As 501c3 organizations, we cannot and do not endorse any candidates for office, and so no endorsements will be forthcoming as a result of this educational forum. I also want to reiterate that this is a safe space, and while we encourage all questions, it's important to note that disrespect and uncivil remarks or questions will not be tolerated. So if there are any such questions that come forward, I do have the discretion to stop the forum at any time, and we also have the discretion to result in exclusion of individuals from future forums. Candidates are expected to, and I do expect they will, maintain civil discourse in sharing their vision and their responses. Now, while each candidate will have the chance to answer questions, there will be no time for rebuttals. And I want to remind those in the audience who do have questions over the next hour to use the chat box to submit their questions. The chat box will be monitored so that your questions can be surfaced at the end of the moderated session. And with this, I will be turning over to the moderated session. We're going to start by providing each candidate an opportunity to speak for 2 minutes and start by telling us about themselves and the inspiration for running for this particular seat. We'll begin with Jesse Arreguin and then turn the session over to Jovanka Beckles. Jesse, could you please tell us a little bit about yourself and what motivated you to run for Senate District 7?
Well, good afternoon. Honored to be here. Honored to also be the only candidate endorsed for Senate District 7 by the California Primary Care Association Advocates because of the work I've done to advocate for health equity and health access. And I'm running for the state Senate because I believe that the East Bay needs a proven progressive problem solver that will fight for more housing, for safer neighborhoods, for universal health care, and fully funding our schools. I'm the current mayor of Berkeley, and I've served on the Berkeley City Council for the past 16 years and as an elected leader in Berkeley for 20 years. And proud to have led our city through a period of transformative change. We're building thousands of new homes. We worked to get our community through an unprecedented global pandemic with the highest vaccination rates and lowest case rates of any city in the United States. We are working to address the public safety challenges that many communities in the East Bay are facing, but through a new paradigm for public safety that involves unarmed, non-police public safety responders. We launched a specialized care unit, which is a team of nurses and social workers that respond to behavioral health and public health calls, diverting those calls from police to appropriate public safety responders. And we're working to compassionately and effectively address the crisis of homelessness. Berkeley's work to address homelessness has resulted in a 45% decrease in unsheltered homelessness over the past 2 years. I'm proud of the progress we're making to get people off the streets into permanent and stable housing. And I think housing, the lack of access to housing, is a health equity issue. It is a healthcare issue. And really also proud to have led Berkeley over these past several years with a particular focus on health equity and health access. Proud that we are one of the few cities in the state of California that has its own local public health jurisdiction, working in partnership with many of our FQHCs, including lifelong medical care, to provide direct primary care for people in our community. And another issue that I'm deeply concerned about and working very actively on and want to work on in the legislature is the imminent closure of Alta Bates Hospital and the impact that's going to have on healthcare in our district, and look forward to talking more about that this afternoon.
Thank you very much. Jovanka, to you. Oh, you're muted.
Okay, there we go. Thank you so much for everyone taking your time to get educated about this, our democratic process. My name is Jovanka Beckles. I use she, her pronouns. I have worked as a mental health professional for 34 years, and 23 of those years I was a wraparound facilitator for Contra Costa County, doing wraparound service specifically with children and families. It's truly an honor to have been able to serve my community in that capacity. It was because of that work experience and also my lived experience as a Black, Latina, queer, immigrant woman that I decided to run for office. One day, my wife and I came home from an event only to be met by 2 armed gunmen, and we were we were subjected to some pretty cruel things. But it was after that I realized that in addition to creating the healing environment that my clients needed, what was missing was policy. And seeing folks struggling to pay rent, seeing folks struggling to buy food, seeing folks struggling to get the health care they needed, seeing people struggling in so many ways inspired me to run for Richmond City Council, where we were able to, along with the community and community organizations like many of the ones on this call, we were able to pass the first ban the box policy, which enabled formerly incarcerated individuals to come back and get employment, passed the first and highest minimum wage in the state of California at the time, passed the first rent control policy in California in 30 years, held Chevron accountable to pay their fair share of taxes, because like most communities,
15 seconds, Jovanka.
Struggling to pay to provide these resources. That's why I'm endorsed by the Berkeley Tenants Union, Oakland Tenants Union, the California Dem Party Tenants Union, mental health care providers like NUHW.
Thank you, Jovanka.
Thank you.
Thank you very much, both Jesse and Jovanka, for your opening statements. We appreciate hearing what motivated you to run for this position and what you're looking forward to bringing into this role if you are elected. At this point, I'm going to turn the call to Julia Liao, CEO of Asian Health Services, to ask the next question. Julia, if you want to go ahead and unmute yourself, go right ahead.
Great. Thanks so much, Tony. So my question is, California's made a lot of progress in expanding, access to essential services, but we know that there are tremendous disparities and inequities that remain, particularly in our underserved areas. So curious to hear from both of you, what are the state level policies that you would support, that you would lead to improve access to critical services in healthcare, education, and housing, especially in areas like District 7?
Thank
Is
you,
that-
Julia, and to Jesse first, and then Jovanka. And then Jovanka, you will have first pass at the next question. Jesse, go right ahead.
Well, we need to ensure that, while the state is balancing its budget, that we continue to prioritize and expand our investment in healthcare and social services, that we maintain that essential safety net. That's why I support Prop 35 to make sure we can permanently extend the MCO tax to provide dedicated revenue to fund Medi-Cal and other healthcare services, to expand Medi-Cal reimbursements, to expand healthcare access. But we need to make sure we're providing healthcare services in a culturally responsive way. And so we need to work to expand language access. I know that's something you've been very actively engaged on. I definitely supported the bill. Very sad that that bill did not advance this year, but I look forward to supporting efforts to expand language access for healthcare services in California. But we need to address the health and economic needs of people holistically. That it means building more affordable housing. I want to make sure that we can bring back some form of redevelopment to ensure that we can provide permanent, stable funding for affordable housing in California. We need to advance a universal healthcare system in California. We need to provide basic economic security. I support creating a form of universal basic income to ensure that extremely low-income people and people that are unemployed or marginally employed have some basic baseline level of economic security. All these things are essential. These are things that I was proud to fight for in the city of Berkeley, and I will be a very fierce champion of making sure that we can preserve and expand the safety net for our youth, for our families, for our seniors, for our disabled community. It is the work you do is absolutely essential. We need to provide more support, more resources, and want to be a partner working with you on this important work on the ground at Senate District 7.
Great. Thank you, Jesse. Jovanka, your turn.
Thank you very much for the question. I'm really proud of the fact that I'm endorsed by so many healthcare providers like NUHW, like Healthcare for All, because they have seen me working tirelessly to ensure that our community gets the services and the resources that they need. I have been, as a wraparound facilitator and healthcare provider myself, have seen the difference that it makes when folk are able to have to be provided the resources and the care that they need in the language that they speak. So I will be a fierce advocate for community health clinics like yours. People need to be able to access health services where they are in their communities. I will be a fierce provider for advocating and funding maternal care, women's health. And through this, we can also include funding wraparound services, not just in public spaces, public institutions like the county, but also through nonprofits like yourselves. It makes a difference when folks have access and the ability to get there and pay for it. And so we also need to ensure when we have a universal healthcare, we don't have to worry about whether Medi-Cal will be funded because everyone will be funded. Everyone's healthcare needs will be met.
Thank you, Jovanka. Okay, we'll now turn to our next question, which is from Cecilia Aviles, who is the CEO of Lifelong Medical Care. Cecilia, if you want to go ahead and introduce yourself.
Thanks very much, Tony. Hello, everyone. Cecilia Aviles, she, her, ella. And thank you both for being here today. So my question is, California is experiencing significant challenges with housing affordability and homelessness. What statewide policies and strategies would you advocate to address these issues and support affordable housing development and homelessness prevention, particularly in regions like District 7?
Thank you, Cecilia. Jovanka, to you.
There have been some wonderful efforts at the state level by legislatures, and some of those I absolutely agree with. Because again, in seeing the challenges that my clients have been experiencing, makes it really easy for me to be able to support things like AB 309, right? We need to build more social housing. We need to be able to fund more affordable housing. And I'm proud of the fact that in Richmond, during my tenure, we passed, built, renovated more affordable housing than the city of Berkeley and other cities in the Bay Area. I am really proud of I'm really supportive of AB 554, where we tax Airbnbs in order to fund low income and moderate housing. There are so many ways that we can also collaborate and make this a collaborative effort regionally. That's why I'm endorsed by tenant champions and housing champions like ACE, like the Berkeley Tenants Union, Oakland Tenants Union, the California Renters Caucus, because they have seen me in the trenches with them fighting for more affordable and low income housing. And that's why one of the first policies I created and worked with the community to bring forward was the first rent control policy in California, not just Richmond, not just the East Bay, but in California in 30 years. That's the kind of innovative, progressive, bold policies and ways of governing that folks can see moving forward as the next senator for this region.
Great, thank you, Jovanka. Jesse.
Well, the housing crisis is deeply personal to me. I'm a lifelong renter, and growing up in San Francisco, and my family, I think, struggled to afford to live in the high-cost Bay Area. We were evicted on several occasions. I know what it's like to lose your home. I know what it's like to not know where you're going to live. And so many families throughout the Bay Area face that struggle on a weekly basis. And that's why I've been a fierce champion for housing justice in the city of Berkeley and in the Bay Area regional level as mayor of Berkeley and as president of the Association of Bay Area Governments. I'm also of a generation that's literally being priced out of our housing market. I will never be able to buy a home in the community that I've lived in for 22 years and I represent. And there's so many people that are being priced out of our region due to the high cost of housing. So I support the work the state has done to build more housing. We need to build more housing for people at all income levels, and we need to protect our neighbors from displacement. I believe we need to focus on the 3 Ps: of production, producing new affordable housing, protecting our neighbors from homelessness and displacement through strong rent control and eviction protections. Proud that Berkeley has some of the strongest eviction protections of any city in California. I authored our eviction moratorium to keep thousands of people stably housed during the pandemic and to launch our rent relief program to provide funding for hundreds of households to stay stably housed. I want to create a statewide rental assistance program to provide assistance for people who are on the verge of eviction and housing insecurity. It's a program we had during the pandemic. We need to make it permanent. We need to also find a stable source of revenue to fund affordable housing. I want to bring back some form of redevelopment to ensure that local governments have the resources to build and preserve affordable housing in our communities. And lastly, we need to preserve naturally occurring affordable housing. I'll just say that I'm proud that during my time as mayor, Berkeley has built the most low-income housing than any time since World War II.
And I
want to continue my housing leadership in the state Senate.
Thank you. Thank you, Jesse. I appreciate you both providing that response related to housing development and affordable housing, certainly an important issue for our community. Turning to the next question, I will turn the call over to Natalie Aguilera, who is the CEO of Native American Health Center. Natalie, go right ahead, and then we will start with Jesse, followed by Jovanka.
Thank you. Good afternoon. I hope you're in some AC and not melting today, but thank you for being with us today. My question is around the state mandated minimum wage. Although we support increasing the minimum wage for healthcare workers, the minimum wage increase did not include funding or authorize rate adjustments for healthcare providers, leaving community health centers in Alameda County projected to face an additional $22 million in annual costs by 2027. What policy or budget strategies would you advocate to help healthcare providers, particularly community health centers, so we can manage these increased costs while ensuring the successful implementation of the minimum wage law?
Well, thank you for that question. I fully support the increase in the minimum wage. It's important that we have policies that increase wages and have strong labor standards, but we need to ensure that they're done in a thoughtful way that takes into consideration how they're going to impact our nonprofit organizations, including our federally qualified health centers. And This is something that I have done when we brought forward legislation in Berkeley, working with Lifelong and other nonprofit entities to think about the impacts of those policies to ensure that workers benefit, but also we think about how they can be done thoughtfully. We do need to increase reimbursement. So if the state is going to increase wages, there needs to be some offset. That's why, once again, I support Prop 35 to put in place the MCO tax as a permanent tax without having to go back every few years to have to extend it and then have the state siphon the money off to balance the budget. That money should go towards expanding Medi-Cal and increasing Medi-Cal reimbursement. And that is a huge issue towards people participating in the Medi-Cal program and making sure that our community-based health providers are adequately compensated for the cost of services they provide. And this will expand healthcare access throughout California. So that's one way that we can address the issue. I'm certainly open to listening to our nonprofit health providers and really being an advocate to think about how we can implement these policies in a thoughtful way that ensures that you can continue to operate sustainably, but also make sure that we pay our workers fairly.
Thank you, Jesse. Jovanka, to you.
It's so important that we have champions for healthcare in the state. I've worked in my capacity as a healthcare provider, mental health specifically. I've seen those challenges. I've seen the challenge of trying to get reimbursed, of what we can bill for, what you can't bill for. So I get it. I believe it's important that we have the reimbursement rate, first and foremost, needs to be raised. And I believe who better to trust to do that than someone who has been living that and seeing what it does to healthcare providers like yours. It's going to be important for us to make full use of federal funding, but also that in the state, we set aside funding to be able to fund the services that you all provide. It's so important that we provide funding to pay for these costs. You all shouldn't be struggling to figure out how to serve the community and yet still function. That's not fair. It's not fair for anyone, and that's something that I'm fully. I'd be a champion for, and my door would be open, right, for us to create and write policies. All of the amazing policies that has gained Richmond national recognition that I brought forward came forward as a result of collaborating with the community. So it's going to be important for everyone to be able to get have staff, provide the services, and still pay folks the living wage that's needed. Again, I'd be a champion because of the work that I've been doing. And why can I be trusted to do that? Because I'm the only corporate-free candidate in this race. That is critical to everything that we're talking about. Someone who's not taking the money from the healthcare,
10 seconds.
From healthcare lobbyists and so forth, but it's solely beholden to the community.
Thank you, Jovanka. We'll now turn to Jane Garcia, CEO of La Clinica de la Raza.
Thank you both for making the time to come talk to us. We really value the opportunity. While CalAIM advances health equity by authorizing Medi-Cal reimbursement for services provided by community health workers, promotoras, doulas, and wellness coaches, ironically, community health centers are not able to be reimbursed for these services under the current prospective payment system. Yes. Additionally, unlike other healthcare provider types, community health centers cannot receive reimbursement for providing both a mental health service and a medical care service to the same patient on the same day. It drives us crazy. What policy or appropriation changes would you champion to address these reimbursement challenges faced by our community health centers?
I believe it's me.
Jovanka, you're leading us off this time. Thank you.
Well, believe me when I say it drove me crazy. In fact, it was so crazy making so many of our therapists and psychiatrists and psychologists and mentors started thinking about other ways to make a living and other ways to serve, because it wasn't fair. We had to always, rather than thinking about what is the best service approach that we can provide that's going to help our clients, our patients, we were oftentimes thinking, can I bill for this? And that's not why, we get into this work. We get into this work because we want to do the best job we can. And whatever our patients, our clients need, that's what should be funded. That's what should be reimbursed. So I really believe that community health centers are so important, and the parity, and the need for parity, for equity, needs to be, there needs to be a better system in place. And my colleagues at the West County Health Center were really excited about the fact that I'm running for this office, because they know that they will have a champion, because they know that I've seen firsthand the inadequate way of reimbursing, and also why some services were not reimbursed by Medi-Cal. But again, that's why we need a universal healthcare system. We need a system that everyone will be provided with the resources they need,
30
and
seconds.
not having to worry about what's billable and what isn't. It's not right.
Thank you, Jovanka. Jesse.
Well, we absolutely need to reform the Cali system to ensure that services, including comprehensive public health and mental health services, are fully reimbursed. And while that's one issue, we need to make sure that, while we're increasing our investment in our Medi-Cal system, that we're making it easier for our community health providers to actually be able to deliver those services. So, we do need to reform the prospective payment system to make it easier to move towards a system of whole person care. That will ensure better patient outcomes and ensure that we can provide a range of holistic healthcare services and make it easier for our nonprofit providers to be able to deliver those services. So you can count on me to be a partner and advocate for looking at how we can streamline and really take advantage of the ability to maximize reimbursements and maximize resources to better improve patient care in California.
Thank you both. And now our final question comes from Robert Phillips, CEO of Baywell Health. Robert.
Thank you, Tony. And thank you all for both being so thoughtful and engaged. So communities across California are currently stressed with real workforce shortages in healthcare, education, skilled trades. That's currently impacting our community's well-being. When you're in office, what would you champion to tackle these shortages and make sure that we're training and hiring and keeping the people we need in these essential jobs?
Thank you. Jesse, to you, please.
Well, we are definitely facing a healthcare workforce shortage throughout our healthcare system, especially in primary care. And I would support earmarks in the state budget to address healthcare worker retention, to support funding for our career pathway programs in our high school and community colleges, to train students to enter the healthcare industry. I think there's enormous opportunity through our community college system to help grow the healthcare workforce. And then also look at how we can take a portion of the managed care tax to go towards funding recruitment and training efforts, especially in underserved communities. We have a Teach for America program. We need to look at how we provide career incentives so that we can grow the workforce, particularly in underserved communities, to make sure that we have the people to provide these critical services. So we need to do all that, and that requires leaders who understand the state budget, who will fight for increasing funding in the state budget for workforce development and to fund our essential healthcare system. And these are things I would love to work with you all on if I'm fortunate to be your state senator.
Thank you, Jesse. Jovanka.
As the only, I'll keep repeating this, as the only corporate free candidate in this race, it's so important that we have people who are not taking money from corporations or not taking money from lobbyists. And with that said, that's why I am currently a fierce advocate and will continue to be an advocate from what we currently see now. What we currently see now is a system, a school, a school to prison pipeline. What I've been fighting for and will continue to fight for is a school to workforce pipeline. That's what we need. And folks ask, well, all these so-called free things, Jovanka, like what I believe we need free pre-care, free pre-K. We need folks to be able to have childcare, that they don't have to struggle to pay either their childcare or go to work, and it creates an awful downward spiral. We need higher education that doesn't put folks in debt when they come out, as well as trade school, as well as assistance and the ability for people to go to trade schools. And so, yes, how do you pay for that? Well, the question always comes to play when it comes to social safety nets like these, right? Social resources. You pay for it by taxing the mega wealthy, by taxing corporations. And because I'm not beholden to them, I have no problem ensuring and demanding that they pay their fair share taxes, as I did as a Richmond City Council member. We demanded that Chevron pay their fair share of taxes because
20
we
seconds.
were able to elect corporate-free candidates. And because we demanded that they pay their fair share of taxes, we were able to get over $100 million, and now in 2024, $500 million from Chevron. But at the time, we used that money to create the Richmond Promise Program, which created college scholarships for
Thank you,
high school
Jovanka.
students. This is what we need more of.
Okay. Thank you very much. And with that, we have concluded the prepared moderated session, but we do have a few questions that have come up from participants. I'm going to start with a question that has a reflection on today's climate. We're having a record high temperature day today, and days like this feel more and more frequent. In facing future emergencies, including natural disasters and public health crises, what measures would you propose to enhance California's preparedness and response? And the second question related to that is, how would you ensure that both urban and rural communities are effectively supported during such events? Jovanka, to you first, and then followed by Jesse.
What we're seeing is heart-wrenching. It's scary. I have grandkids. I want them to have a future. Everything that I talk about, everything that I fight for has to do with our future. And if we don't have a planet, nothing else really matters. It won't matter at all. And so that's why I have always maintained a corporate-free stance, because we have to be able to hold corporate polluters accountable, especially the fossil fuel industry, who've known that their product is leading to the kind of climate change that we're seeing. So we have to transition away from the fossil fuel industry. We have to create green new jobs. We have to help with a just transition to help these workers who are currently in this extractive economy to be able to transition into a green new economy. We have to stop permitting, giving out more permits. And one of the things is we have to be able to hold these corporate polluters like PG&E, who contribute to so much of what we're seeing. We have to be able to hold them accountable, and that's not going to happen with candidates who are taking their money. We have to be able to have folks who are not taking the money from entities like PG&E. We have to have people who are not beholden to the fossil fuel industry. Right now, folks are struggling in so many ways. And what we're seeing in Sacramento is we have a governor who also has taken an immense amount of money from PG&E. And so he's not going to hold them accountable either. He's not going to hold the fossil fuel industry accountable. But the community can trust that that's exactly what I'll be doing, because it's what I've always done, is held these corporate polluters who are contributing to global warming accountable.
Okay, thank you, Jovanka. And Jesse, to you.
Well, the extreme weather conditions that we're seeing are now becoming common because of the worsening climate emergency. And that's why I'm proud that really Berkeley has led statewide efforts to transition off of fossil fuels and to advance a fossil fuel future. We were one of the first cities in the United States to promote electrification of new construction. We are working to build safer streets and to make our streets safer for people walking, biking, investing in public transportation, and working to address climate adaptation. We need to recognize that while we need to transition much more rapidly off of fossil fuels and fossil fuel production extraction in California, ensure a just transition for workers, we also have to mitigate the impacts of extreme weather conditions and the climate emergency that our community is facing, whether it's rising sea levels, which disproportionately impact frontline communities, whether it's the risk of wildfire, or whether it's extreme weather conditions. And so we can't go backwards, we have to go forwards. So we have to recognize that we are in a new, very rapidly evolving situation. So we're fortunate that Senator Skinner, who has been our longtime representative, has been a fierce climate champion. I'm honored to have Senator Skinner's sole endorsement to succeed her in the California State Senate, and I will continue her work to make California a national leader in addressing the climate emergency, making sure that we create good, clean tech jobs, that we advance electrification, that we invest in public transportation, that we work to help support and mitigate the impact of climate change that our communities are facing, and work to promote more resiliency and equity in how we address the climate emergency as well.
Thank you very much. And turning to the second question that we have received from the audience, it always feels like safety net programs feel the squeeze when it comes to the state budget. We know that California is facing a severe fiscal crisis at this point. Given California's current fiscal challenges, legislators such as yourself, if you are voted into office, must make tough decisions about sustaining or cutting funding for public education, healthcare, social services, housing, food assistance, environmental programs, and potentially raising taxes to close revenue gaps. What is your philosophy for prioritizing these competing demands? And how would you approach balancing these priorities in the state budget? Jesse, we'll start with you. 2 minutes, please.
Well, the budget is a reflection of our collective values. And so housing, healthcare, supporting our unhoused communities, education, these are essential, non-negotiable priorities. And as a member of the Berkeley City Council and as mayor for the past 16 years, I have balanced many budgets, including the largest budget deficit in Berkeley's history, a $40 million budget deficit. And thanks to good fiscal planning, creating a rainy day fund, we were able to weather that budget deficit, and while also setting up Berkeley for a fiscally sustainable future. So there are many things we have to do. One, we have to continue to fight for these essential priorities, and I will never waver in my commitment to these essential services. But we also have to reform our state's tax policy to make it more progressive and equitable. It is unacceptable that the largest corporations in California are not paying their fair share because of loopholes under Proposition 13 that do not ensure fair progressive taxation. It's unacceptable that large oil companies are not paying for the social impacts and public health impacts they're creating on our state. It's not acceptable that the wealthiest people are not paying their fair share, and that could generate billions of dollars that we can invest in public health and other essential services and public education. I have fought corporate interests to fight for these essential services. I will fight for these values and these priorities in the California State Senate.
30 seconds. Okay, thank you. Jovanka.
You know, my philosophy has always been and continues to be no cuts to vital services, no regressive taxes. We cannot continue to fund programs off of the backs of the people that need these programs. So I don't believe in regressive taxation. I believe that we have to and must tax corporations. That's why I don't take any of their money, because if I take their money, I am not going to be working for the people. I will now be working to maintain the profit margin of these corporations. So that's why I believe we have to reform Prop 13. Prop 13 is a huge loophole that absolutely needs to end. And I'm also tired of seeing that when the state gets in trouble fiscally, that the cuts that always happen are always vital services to the people, like I said, at-risk folks who need it most. And so as your state senator, I will always work with the community to ensure that we have what we need. We have to, we have to protect, do whatever we can to protect low-income folk. We have to do everything that we can to protect seniors, homeowners, renters, all of these things, which is why I'm endorsed by so many grassroots organizations who are on the ground every single day working
30
to ensure
seconds.
that our communities have the resources that we need.
Great. Thank you. A new question from one of our participants. The state has passed mandatory implicit bias training for hospitals. However, racism is still blatant in some cases. What additional policies can address this issue? And this question is first directed to Jovanka.
So would you repeat the question again about, please repeat it for me.
Yes, a little bit of context in terms of racism in healthcare, institutional racism in healthcare. The state has passed mandatory implicit bias training for hospitals, but racism is still blatant in some cases. What additional policies can address this issue?
For me, as I mentioned, I live at the intersection of 5 marginalized communities. I'm a Black, Latina, queer, immigrant woman. All of these communities have seen what happens to us in the healthcare industry. Data shows that Black women, for example, are not taken seriously, particularly when it comes to postpartum healthcare issues. I know that LGBTQI people face challenges as well, and so that's why it's so important that we have to have a workforce that understands, or I have these lived and work experience, understand what racism truly is. Because when you have a diverse workforce that understand this, then implicit bias trainings could go by way of the wayside, because we now have a workforce that represents the diversity of the patients, of the population that we serve. I think it's a good thing, however, to continue to have these kinds of trainings. However, until we address racism as a whole, I just don't see how we're going to be able to address the types of racism that we see in the healthcare industry. But all the more reason why it's so important that we have people who reflect
20 seconds.
Who reflect the diversity of our community. And the Bay Area is one of the most diverse areas of California. And it's been 30 years since we've had a Black woman or a Latina, for that matter, any person of color, for the last 30 years. It's time for us to have representation at the state Senate to be able to address these types of issues, because representation truly matters.
Thank you, Jovanka. And Jesse, same question.
I agree that representation matters. And if elected, I'd be the only Latino to serve in the California State Senate representing Northern California. And I come to my public service with my lived experience growing up in poverty as a son and grandson of farm workers, somebody who's fought for economic and social justice my entire life. But we have to recognize that systemic racism pervades every aspect of our society, including our healthcare system. And we saw during the pandemic, the people that were disproportionately impacted and died due to COVID-19 were essential workers in Black and brown communities. And that is because of the systemic racism and the systemic inequity in our healthcare system that you are working to address through the important work that you do. So part of it is implicit bias is great, but we need to ensure that that the services we fund and the budget decisions the state makes are done with a racial equity lens, that we are advancing racial equity and economic equity in the investments that we're making at the state level. We also have to recognize a lot of communities of color don't trust the healthcare system. So we need to support increased funding and partnerships with culturally responsive organizations and providers in the neighborhoods where communities of color work. So we need to provide funding for outreach and community engagement. Cultural competency and language access is extremely important. This has been the key focus of the work that we've done in the City of Berkeley Health Department, launching culturally relevant, responsive outreach and services. And I'm proud that we're looking at other things in Berkeley, creating the first health equity zone in the historically African-American neighborhood of South Berkeley, looking at how we can expand healthcare access through culturally responsive, linguistically relevant services. So that is the work that I will support, working in partnership with you and making sure that we expand healthcare access so no community, including Senate District 7, is a healthcare desert.
Okay, thank you. Thank you, Jesse and Jovanka. This concludes our question and answer session during this candidate forum. Take a deep breath. We will be turning now to allow each of you to provide closing remarks. You will each have 2 minutes to close out your comments. And for this session, I will turn first to Jovanka and then Jesse, have you provide your 2-minute wrap up. Jovanka, to you, please.
Thank you all for doing this. As I mentioned before, representation matters. As a Black, Latina, queer, immigrant woman, I live at the intersection of so many marginalized communities. I understand the challenges our community faces because I live it. I've put in the work for almost 20 years as an elected official and as a responsive public servant. I know how to work with others because I respond to my constituents. When I get calls, I respond. When I get calls that people feeling challenged, I respond, and I respond swiftly. So swift action matters. Not taking corporate money matters. If our goal is to get universal health care, affordable housing, LGBTQI plus rights enshrined, no corporate influence matters. If our goal is to protect women's reproductive rights and workers' rights, and if we are to hold polluters responsible, zero corporate influence matters. If we are to protect our democracy, we have to have people who are free from corporate influence. My track record for improving the quality of life for East Bay residents has brought together an amazing list of endorsers, some from across the country, like Senator Bernie Sanders, like Bill McKibben, like the National Union of Healthcare Workers, SEIU California, the California Teachers Association, Women in Politics, the California Labor Council, the Greens and Independents, Democratic clubs, environmental organizations, the Asian Pacific Environmental Network. These folks know that I can be trusted to do exactly as I promised. And I thank you all for this time, and I'd be honored to have your support as your next senator, because we truly need folks who don't just talk the talk, right? We need people who are actually walking the walk and being bold.
Thank you. Jesse, 2 minutes, closing remarks, please.
Well, I want to thank you for the work you do in providing critical lifeline services to low-income residents, working families, children, and seniors. I strongly believe that healthcare is a basic human right, and you're critical partners in this work, and I look forward to working with you, and I'm honored to be the only candidate for SD7 endorsed by CPCA advocates because of the work I've done in partnership with our local community health centers, the work I've done to advance health equity and health access, and that will continue to be a priority of mine in the California State Senate. But I'm proud of the work that we've done in Berkeley to address health equity, to improve health outcomes. Berkeley was the first city in the United States, working with some of you, to pass a tax on sugary beverages. We have a measure on the ballot this year to extend that tax. I was very proud to help lead that effort to put that on the ballot. And we've worked to not just expand healthcare services in a way that's culturally relevant and linguistically relevant, but also helping ensure that while we address an unprecedented global pandemic, that we centered equity and health access in the work that we've done. I'm honored by my record of effective progressive leadership. That's why I have the sole endorsement for outgoing State Senator Nancy Skinner, Governor Gavin Newsom, and many organizations, including the Democratic Party, Planned Parenthood, Equality California, the Sierra Club, the California Professional Firefighters, and hundreds of elected leaders throughout Senate District 7. If you live in the district, be honored to have your vote. And thank you for the important work you do. Look forward to working with you as our next state senator from the East Bay.
Thank you very much. I want to thank you both, Jesse Arreguin and Jovanka Beckles, for joining us today. We appreciate having you join in this candidate forum and sharing your priorities and vision. I also want to thank all of the attendees who have joined us and listened to your comments and the policy ideas that you have should you be elected into office. I do want to give special thanks to the staff at the Alameda Health Consortium who helped to make this forum happen. Zara Zaidi, Jody Zahoda, and Janae Hawkins, we truly appreciate everything that you have done to facilitate today's forum. And thank you to our CEOs and leaders from the community health centers who are providing services in this particular district. The recording of this discussion will be uploaded to the Alameda Health Consortium YouTube channel, and we will share the link with your colleagues. We encourage you to share it with other community members. As we are winding down, I would be remiss if I did not encourage people to recall a few key important dates. October 21st is the last day to register for the general election. October 22nd through November 5th, there is still same-day registration available, and November 5th is Election Day. We do know that ballots will be dropping in the mail shortly, so look out for ballots if you are already a registered voter. And we do have a resource link for you to visit the Alameda Health Consortium website for more voter information. Again, we want to thank our candidates and our CEOs and all of the attendees who have come together this afternoon for a very important conversation. We appreciate both of you, Jesse and Jovanka, for being out in the community, for running for office, for raising important issues and being part of a public discourse about what is important for our community. Thank you everyone for joining. Have a good rest of your afternoon. Bye-bye.